Hey everyone! Welcome back to another lesson. Today, we're tackling a topic that might make you squirm, but trust me, it's crucial info for many of you out there. We're diving into the world of enlarged prostates and the medications to avoid if you're dealing with this common issue. Now, before you click away thinking, this doesn't apply to me, listen up. Whether you're a guy over 50, know someone who is, or just want to be prepared for the future, this lesson is for you. We're about to uncover the sneaky meds that can turn your bathroom trips into an obstacle course. You know those frustrating moments when you're standing there willing something to happen. Or when your sleep is interrupted by midnight sprints to the toilet. Yeah, some medications can make all that worse. Many medications we're going to talk about in this lesson come from the article entitled Contribution of Common Medications to Lower Urinary Tract Symptoms in Men. The first class of medications to avoid if you have an enlarged prostate is antihistamines. Now, I know what you're thinking. Antihistamines? But those are my allergy lifesavers. Well, hold on to your tissues because we're about to uncover why these sneaky little pills might be causing more trouble than they're worth for men with enlarged prostates. Picture this, it's spring. Pollen is floating through the air like nature's confetti, and your allergies are throwing a party in your sinuses. You reach for that trusty antihistamine, thinking you're about to show those allergies who's boss. But wait. If you're dealing with an enlarged prostate, also known as benign prostatic hyperplasia, or BPH for short, you might be setting yourself up for a different kind of trouble. You see, these allergy-fighting superheroes have a dark side when it comes to your prostate. They're like that friend who means well but always ends up making things worse. Antihistamines have been found to worsen lower urinary tract symptoms, or LUTS for those who love a good acronym. And trust me, when we say worsen, we mean it can turn your bathroom trips into an Olympic event. It's important to try to avoid using antihistamines. Some examples of antihistamines include Benadryl, diphenhydramine, Claritin, Loratadine, and Zyrtec, cetirizine. These common antihistamines can worsen symptoms associated with an enlarged prostate. The next class of medications to avoid is decongestants. Decongestants are medications commonly used to relieve nasal congestion caused by colds, allergies, or sinus infections. You can find them in over-the-counter products like Sudafed, pseudoephedrine, and phenylephrine. These medications work by narrowing the blood vessels in the nasal passages, which reduces swelling and congestion. While they can be a lifesaver when you have a stuffy nose, they can spell trouble if you have an enlarged prostate. Here's the kicker. Decongestants don't just constrict blood vessels in your nose. They also affect other smooth muscles in the body, including those around the bladder neck and prostate. This constriction can make it even more difficult for urine to pass through the already narrowed urethra in men with BPH. The result? Worsening of urinary symptoms such as increased difficulty in starting urination, a weaker, more intermittent urinary stream, more frequent urges to urinate, especially at night. Another class of medications to avoid with an enlarged prostate is non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are a widely used group of medications that include ibuprofen, found in Advil and Motrin, naproxen, found in Aleve, and aspirin. These medications are commonly used for pain relief, reducing inflammation, and lowering fevers. They're a go-to choice for many people dealing with headaches, muscle pain, arthritis, and even minor injuries. But if you have an enlarged prostate, also known as benign prostatic hyperplasia, BPH, NSAIDs might not be the best option for you. Here's where things get interesting. There is some conflicting evidence regarding the use of NSAIDs and their impact on prostate health. Some studies suggest that NSAIDs might actually reduce the risk of developing BPH and alleviate some of its symptoms due to their anti-inflammatory properties. However, other studies indicate that regular use of NSAIDs can lead to an increase in prostate size and a worsening of urinary symptoms associated with BPH. Thus, it's important to either reduce or try to avoid NSAID use, although it can be difficult with some conditions that involve pain control. Another class of medications that can worsen symptoms associated with an enlarged prostate is opiates or opioids. Opioids are powerful, pain-relieving medications that include drugs like morphine, oxycodone, OxyContin, hydrocodone, Vicodin, and codeine. They work by binding to opioid receptors in the brain and spinal cord, reducing the perception of pain. While highly effective for severe pain, opioids come with a risk of dependence, addiction, and a range of side effects. Now, you might be wondering, how do opioids affect someone with BPH? The relationship between opioids and BPH is a bit complicated. Opioids can significantly impact BPH symptoms by causing urinary retention, constipation, and sedation. These medications interfere with the nerves that control bladder function, making it difficult to fully empty the bladder, which exacerbates the urinary problems already present in BPH. Additionally, opioids often cause constipation, increasing pressure on the bladder and prostate, further complicating urinary issues. The sedative effects of opioids can also reduce the urge to urinate, leading to increased urinary retention. Together, these side effects can make managing BPH symptoms even more challenging for those who need opioid pain relief. Another class of medications that are bad for an enlarged prostate is tricyclic antidepressants, TCA. Tricyclic antidepressants are a class of medications originally developed to treat depression. Some common CAS include amitriptyline, nortriptyline, and imipramine. While their primary use is for mental health conditions, CAS are also prescribed for chronic pain, migraines, and certain anxiety disorders due to their pain-relieving properties. Tricyclic antidepressants, CAS, can significantly worsen symptoms of benign prostatic hyperplasia, BPH, due to their strong anticholinergic properties. These properties block the action of acetylcholine, a neurotransmitter crucial for muscle contractions, leading to relaxation of the bladder muscles and prostate. This relaxation makes it difficult to empty the bladder fully, exacerbating urinary retention. Additionally, CAS can impair the bladder's ability to contract properly, causing issues like difficulty starting urination and a weak urinary stream. Moreover, the sedative effects of CAS reduce the sensation of needing to urinate, further increasing urinary retention and causing more frequent nighttime urination, disrupting sleep and overall comfort. The final worst medications for prostate health on our list is diuretics. Diuretics, commonly known as water pills, are medications that help your body get rid of excess salt and water by increasing urine production. They are often prescribed to treat high blood pressure, heart failure, kidney problems, and certain types of swelling, edema. Common diuretics include furosemide, Lasix, hydrochlorothiazide, microzide, and spironolactone, aldactone. Diuretics can significantly impact symptoms of benign prostatic hyperplasia, BPH, in several ways. First and foremost, diuretics are designed to increase urine production, which can worsen the frequent urination and urgency that individuals with BPH already experience. This is especially troublesome at night, leading to nocturia and increased need to urinate that disrupts sleep and affects overall quality of life. Additionally, some diuretics can irritate the bladder, intensifying urinary discomfort and creating a heightened sense of urgency, making it even harder for those with BPH to manage their symptoms. Furthermore, the use of diuretics can lead to dehydration and electrolyte imbalances, which, while not directly linked to BPH, can complicate the overall management of the condition and lead to additional health issues. These effects underscore the importance of carefully monitoring the use of diuretics in patients with BPH to avoid exacerbating their urinary symptoms. If you're interested in discovering which drinks to steer clear of with an enlarged prostate, be sure to check out my lesson on that subject. Additionally, take a look at my lesson on fruits that can help prevent prostate enlargement from occurring. Thanks for watching our video on medications to avoid with an enlarged prostate. We hope you found this information helpful and informative. Remember, managing your health is a journey, and being aware of the medications that can worsen BPH symptoms is an important step. If you have any questions or personal experiences to share, drop them in the comments below. We love hearing from you. Don't forget to like this video and subscribe to our channel for more health tips and advice. Hit that notification bell so you never miss an update. Take care, and we'll see you in the next video.